Hello, good morning, everybody. Are we ready to start? Hello. Okay. Magandang umaga po. It's now 10:08 and we are ready for our second edition of the Balik Kabuhayan webinar series of Go Negosyo Project ARC. Good morning. We are live on Go Negosyo. Please direct your friends and families and co-workers to the Go Negosyo Facebook page. And that is Facebook Live. Oh, is there a problem with the video? Can you hear me? With the audio? Can you hear me? Okay, now. Okay, good. So we're ready to start. Almost all of our speakers are here, but most definitely the first speakers are here. My name is Jopin Romero. I am the Project ARC lead here to introduce the session to you and our first speakers. But let me give an overview first of why we are here today. With the continuous rise of the number of COVID cases in the country, the risk of infection is now far greater and more people are uncertain as to what we are expecting. As we continuously open more of our economy, we need to create more visibility and come up with a defense strategy to coexist with the virus. So welcome to this Go Negosyo Balik Kabuhayan series entitled, How Do We Prevent Our Companies from COVID-19 Infection? 4 months have passed since the Philippine government implemented various categories of community quarantines across the country, especially in Luzon, where most of the cases are. Now, it has hurt much of our economy, local and national, especially our micro, small, and medium enterprises, as business operations were halted. This special webinar, organized by the Office of the Presidential Advisor for Entrepreneurship, in partnership with Go Negosyo, major business organizations, and medical associations, aims to discuss the overall health and management that is critical in keeping the health situation under control. Once infection levels stabilize, we hope that we can open the economy even further and save as many jobs and livelihoods as we can. So, before we start this session, we'd like to say hello to our friends on Facebook. So as of now, we have over 200 people watching us and we have thousands of viewers already. Welcome po. We will be checking the Facebook Live and our chat box from time to time to pick out some questions and comments, which we will be passing on to our moderator later on and to our panel speakers. So to formally kick off today's program, let us now please all welcome the Presidential Advisor for Entrepreneurship and founder of Go Negosyo, Mr. Joey Concepcion.
Good morning. First of all, I'd like to welcome all of our friends here from the community, Project ARC, and our different chamber heads, business organization. I can see Nonoy Espeleta. So hi, Nonoy. I think you're getting your dialysis machines, and I hope Cebu is getting a grip of the infection level. So I guess the dialogue has worked the last time we met with Secretary Galvez. I also see George. Been a while, George. So to the rest, I guess, as Jopin was saying, it's basically 4 months since the lockdown on March 15. And if you look at it, it took us about 2.5 months to get to GCQ, which was in June 1. Today is June 14, which is basically 4 months. And we had a total of 5 resets, which one reset is 14 days. So by and large, we had one of the longest lockdown, I think, in the world. I mean, you look at it, and I think the lockdown on March 15 was the best thing that the president did, and I think that it paved the way for our men in government to really scale up the facilities, especially the quarantine centers. I think that is one of the good things that we did, was to lock down early. If we look at it, I think one of the other good things that the president did was to appoint Secretary Galvez as the chief implementer. And now he has a deputy implementer with Vince Dizon, who is supposed to be heading the test as test czar. No? And I think recently the president appointed more czars from isolation to others. No? So I think there's going to be greater focus that is needed. No? And from the private sector side, when we started Project ARC, that was sometime April, when we got really started. We launched Project ARC with 350 companies willing to really take control of their own health situation and close to 1.3 million test kits back then were ordered. Prices of rapid test kits went down to as low as 450. Caroline Tanchay, who is the importer for Innovita test kits, we were able to persuade her to drop that price down to 450 when the prevailing prices of rapid test kits were at the level of 800, 900, even 1,000. So that was a good way. I mean, we made rapid test kits available at much cheaper prices. During that period, we did not have the capacity for RT-PCR. Compared to today, we're hitting close to 50,000 testing daily. I mean, in terms of capacity, whether we're testing 50,000, that's a different question. But those days also we had quite a debate as to the use of rapid test kits, its accuracy. But then again, if you look back, and we will share the information coming from the private sector later on the results, no? And why that was the best option at that point in time. Looking back, I think it was the right thing we did to really encourage the use of rapid test kits. And in my meeting with the president a month after the lockdown, he was able to, I was able to persuade them to import rapid test kits and allow the use of rapid test kits. So, and I remember that day when he instructed Secretary Carlo Nograles to really find a way, and they did find a way. So they brought in, I think, close to 2 million rapid test kits. So during that period, there was really no way to create greater visibility. Of course, hindsight is always a perfect vision, and I don't want to go back there. No, I mean, but we have to try to understand what did we do right and what did we do wrong. No? And I think locking down early and preparing ourselves was the best thing. Whether it was too long a lockdown, maybe, but in the end, it allowed the government to prepare the facilities needed, no, to prepare for us in case a surge would not be containable. No? So that was good. Now, what we have learned here moving forward is after 4 months, the cases seem to be rising. The infection levels have gone up. And that is expected as we really are opening the economy now, moving from ECQ to GCQ. And if I were to look at our GCQ today, it's not really even full blast because public transportation is still not accessible. So that is containing still the number of people joining the workforce. Most companies are still on a skeletal workforce, except for those in the production centers. So that is a bit of challenge. And but the intention is to open the economy. As we can see in the last 4 months, the economy has really been greatly affected. And I think talking to Secretary Galvez, he understands that it is very difficult for us to turn back to ECQ because at this point in time, we are now at that brink whereby a lot of businesses are struggling to even operate at a positive working capital or a positive cash flow. So wherever I look, and I'm sure our business organizations and in fact have the same feeling that the economy is in a serious state. And I have to state that as a fact that many of our MSMEs are really challenged. And in in an event launched by AFI, the Association of Food Franchises, you can see that the spirit and the emotion is there, no, of many of these people who've done well, started their business, moving up, and all of a sudden hit by this pandemic, they basically start back from zero. So, of course, the people in the essential sector are lucky. I mean, but not everybody is in the essential sector. No? So we really have to keep this economy open, and that's the only way that I think we can survive this pandemic. And what is, I think, what should we do, no, in the private sector? And I think with Miguita Padilla, who joined us earlier on in Project ARC, developing the protocols for rapid test kits, that was great. Then that was followed by former Secretary Janet Garin, who now is our private sector implementer for RT-PCR and helping push the platform for RT-PCR pool testing. So, as you know, we've been advocating for test, and the importance of creating greater visibility is mandatory. It's, to me, it's the only way that we can really save the jobs and livelihoods of our Filipino people. There is no other way. I cannot think of any other way aside from locking down. No? A hard lockdown is devastating. So I'm glad that the president also heeded the call from the private sector to switch to more granular quarantine measures, barangay or a street or a condominium or a house. So that is the approach, and giving more power to the LGUs to enforce the lockdowns in this granular type of quarantine, which is the right approach, which will allow commerce to continue. And after meeting with the different mayors in sharing their results of the test that we've done, it has allowed us to exchange ideas, and we got to understand what the LGUs need. And definitely they need support in testing, whether it's rapid test kits or whether it's RT-PCR. And we've also advised them of pool testing that the research has started with the Philippine Society of Pathology and Philippine Children's Medical Center. So these two groups, these two organizations are right now in the forefront of the research. We've funded close to 6 million pesos to be able to get this thing done. Now, my view is we have to test millions of Filipino people. That's the only way to really create greater visibility. We've seen it in the private sector. Let me share with you. Jopin will go into the details, but you know, the revelation really here is, early on, there was a debate as to whether we test only symptomatic and not asymptomatic. But from the results that we've seen from the private sector, what is glaring is that if we did not test the asymptomatic workers that we had, then this could have escalated even to a worse situation. Because if I look at the out of 106,000 were tested, this is just a part of the results, because other companies are still submitting their results, and other companies are still testing. So we have the initial report of 106,982, 665,000 from the private sector and 38,000 from the LGUs. So out of that, if we were to look at it, the IgG was about 2,373, basically past infection, coming from the private sector, about 1,005, from the LGU, about 1,368. On the IgM side, that basically that IgG is about 2.2% of the total 106,982, no, 106,000, no, which is about the expected percentage, no. IgM total is about 1,122, which is 0.1% of 106,000. The IgG and IgM is a total of 1,465, which is about 1.4%. So if you look at those who had previous infection, basically IgG and IgG, IgM, and current infection, that totals 4,960. That's 5.3% of the total 107,782 that were tested. Only 800 were symptomatic. So 4,960 basically were infected, and some of them were currently infected as of the time of testing. So you can see that if we did not test the symptomatic, then that would have been only 800 people that basically we would have tested. So surely 4,960 people, some of them already were infected, and that's why they turned IgG. In fact, in our company, we found a number of those people. So I think it's very important that we really have to test not only the symptomatic, but asymptomatic as well, especially now that the capacities on RT-PCR testing have increased, no? And with the pool testing, the possibility of pool testing happening, whether it becomes a sample size of 10 or 20 to a test kit, that capacity will multiply either times 10 or times 20. And we will be able to bring down the prices of testing tremendously, RT-PCR testing. Continue what we're doing, and testing should not be done one time. I think, and I encourage the private sector to continue to test every 14 days, especially right now that the infection level is up. I think this is our duty to our own workers, no, to provide them the security that the workplace will be safe. And we are able to develop our own strategies on how we can beat COVID in our respective factories, no, or offices. And that is happening today. In fact, I know rapid test kits have proper protocols on getting a nurse and getting a doctor to be guided. But from the way I see it, everybody is using rapid test kits. As you enter a barangay now, some barangays really enforce testing. I see meetings, when you have meetings face to face, some people are now requiring rapid test kits before you're able to join that meeting. So I think we can't stop the private sector or individual groups to use rapid test kits. I think this is their best defense, aside from the norm of face mask and face shield and social distancing. Those are all given, but everybody is trying to find out who out there is infected and who is not. In fact, our social life has changed. My own social life has changed myself. I mean, we are very selective with the people that we go out with. And if we're not sure, then we just don't go out with them. We have basically moved from work from home, which is now becoming the norm. And many of our employees are working from home as well because of one of public transportation. So we're shuttling our workers, basically the factories, because we're in the essential sector of producing food. So looking at that, I think, had we maybe tested also the asymptomatic back then maybe the cases would not be at this level. I mean, if we had greater testing capacity and tested bigger numbers, maybe we would been much better. But then again, these are all hindsights. Nobody, I guess, in our mind, expected this pandemic to be such a grave situation. And moving forward, I think we should do what is right now. And I think, and I'm appealing to the private sector. And we are seeing that uptick right now. Again, the purchases of rapid test kits from various distributors have gone up, which shows that they are going to repeat the process. But testing should not stop, and testing should even increase, because that's our only way to increase visibility. And when we've seen it, when we have visibility, we're able to control our own companies, our own factories much better. We are able to develop strategies to ensure that the infection does not move up. The IgG now, we are using it to monitor the current state of health of our own companies, whereby we don't want to see that IgG number increase. We want that to stay where it is, because if that increases, then that means the infection is increasing in our. So the IgG will be there as a mark for quite some time. So that one, an individual cannot remove his IgG. So that is a good benchmark in determining the state of health in each one's premise, in this office or factory. And I'm told that the zero prevalence test of the LGUs that is being sponsored by T3 is going to start sometime August, and definitely we're looking forward to that. So again, Project ARC has also donated 11 PCR equipments and automatic extraction machines to different 11 government hospitals. Congresswoman Janet Garin has been putting a lot of her time in trying to now fast track the research on pool testing so that we can implement. And once the protocols are out, we will give it to anybody who wants to use it. Joe Pini has arranged the clusters of different groups who will test their employees, who will test OFWs, frontliners, and all of that. And so I think, by and large, we are facing a situation that we have to keep under control. Looking at Thailand, who has no cases, no infection in the last week. In fact, I called Chairman Arin of the ASEAN group there and asked him that maybe we should do a webinar with the ASEAN countries that are doing much better. And maybe you can share with us what are the things that you're doing better than the rest. No? Thailand basically has the same demographic. We have the same number of MSMEs. There's also poverty in Thailand. They have a very humid climate. So if they can do it, why can't we do it? And maybe learn from these countries. So I think we're on the right track. I think the government is on the right track right now. I think the efforts between the public sector and the private sector are now much more aligned than when we started. I think we are now perfectly aligned with the doctors, the Philippine Medical Association, our partners. Of course, Dr. Raymond Lo, who is leading this research together with his colleagues. We're hoping and praying for the best results, because I believe that the next big game changer for us in really ramping up the current capacity of testing here is through pooled PCR testing. So again, I'd like to thank all the ARC companies who are attending this webinar. Please don't continue to test your employees on a regular basis. This is the very least that we can do for this country. If we want the economy to be open and not move back to ECQ, we have to do our part. No? And this is the only way. This is for your company's own protection, your employees especially, and for the country as well. No? So if the LGUs and the private sector would do the testing on a massive level, and look, we're losing billions of pesos on a daily basis when we close the economy. So the only way that we don't close the economy is we have to create visibility. So can I ask Jopin to go into the details of the test results.
Okay, thank you, Joey. I'll keep this short. Give me 2 minutes to give you some visuals with the numbers that Joey showed. Gian, let's share our screen, please. We only have 5 slides, and this will be very fast. So Joey told us about the number of test kits already out there since April. We launched Project ARC on April 23, and these are the total that have been purchased and donated since then. Obviously, this is not total country because there are a lot of companies and a lot of people, a lot of institutions buying directly network. Next slide, please. So, but as you can see, it's a large part of the purchases, procurement of rapid test kits are intended for the workforce. So thank you very much for taking care of our partners, our workers, and our contractuals. Now, let's show you just the trends, no? April, we started towards the end of April. So as you can see, the purchase, it was 25,000, and then it peaked at like 300,000 towards the middle of May. And you'll see that within June, within the end of May and the first half of June, people were actually using the test kits they bought in April and May. That's why you see a downtrend there. But more testing has been happening. So towards the end of June and first week of July, even more purchase orders were noted by our suppliers and reported to ARC. So we saw a 36% increase in purchase orders by the third week of June. That, I think, is testimonial that the companies truly believe in protecting their people. This would also coincide with the opening of our community quarantine. Next slide, please. So these are the numbers in the LGUs. LGUs are also not, what you call this, are not lagging in testing their people. And we have, what you call this, 11 done and 13 ongoing. Even as we speak, we have more LGUs signing up to be partners. We don't want the donations of the companies and of other institutions to go to waste. And also the LGUs recognize this. So what they do is to partner with ARC so that they can follow the ARC test protocol developed by our medical team. Next slide, please. So here are the numbers that were mentioned by Joey earlier. The blue columns refer to the asymptomatic, and that would be 107,000 of the people already reported in Project ARC. Actually, you know, there have been more than 800,000 tested. As you see here, about 107,782 are recorded. You will see the sincerity of the Project ARC companies in reporting the summaries and in trying to help government with the mapping of data. Project ARC itself coordinated very closely with DOH and Thinking Machines through the help of Ms. Georgie Yap, who's also in our panel today. But it is taking some time for the upload of data. I mean, at the very least, it takes a few minutes to look for the barangay code of every person, every worker that is being tested. So, but you can see the earnestness of our companies because they really take the time to do it. It just takes a while to finish it. So as you can see here, look at the blue columns. Those reactive to IgG and IgM are at a low of 1.4%. And IgG positive at 2.2%. These numbers would not have been visible to us had we not done testing of even the asymptomatic. And for the LGU most especially, they have requested this and they continue to request us for additional test kits so that they can open up some more their economy. So call out, shout out to our friends in the companies who still have test kits to spare or money to help donate to these LGUs. And then symptomatic, at least we were able to add and look for additional IgG and IgM reactive people, as you can see on your screen. And last slide, please, to give you a view of where the ARC-PCR donations are around the country. It's from northern Luzon down to the southernmost part of our country in Mindanao. So from Baguio General Hospital, JB Lingad in Pampanga, and then for NCR, we have 3, Jose Rodriguez Memorial Hospital, Perpetual Help in Las Piñas, and PCMC in Quezon City. And then in the Visayas, we have in Iloilo, in Tacloban, in Leyte, and in Cebu. Now, note here that PCMC, Philippine Children's Medical Center, and Perpetual Help Medical Center will be our hospital leads in the pooled PCR study mentioned by Joey, and this will be elaborated on by Dr. Raymond Law and Dr. Janet Garin as we go along this panel. So that's it, just to give you a visual of what Joey related to us a few minutes ago. Now we can get on to the next part of our program. But before I call on our moderator in the panel, please allow me to show you a summary of what the Project ARC has been doing for the last months. We have a 30-seconder. Can we show that, please? We don't have sound, audio. Wala tayong audio. All right, can we try again? Let's try one more time. If it doesn't work, we can do it for later. So we can start with the panel.
1,000 business establishments are feeling the pain of this ongoing lockdown.
Sana kami kukuha ng panggastos namin.
There is no doubt that life is the most important. But however, without the economy, how will people eat? How will people buy medicine? And how will our MSMEs recover? Our whole objective test, and the government will be allowed to open up more of the economy. Yun ang kailangan natin, yung kabuhayan. Kasi kung walang kabuhayan, marami rin namamatay dahil sa hunger.
Let it be said that in the hour of our country's greatest need, we all look out for and help each other. Buksan natin ang ating puso sa nangangailangan.
All right, thank you very much. And with that, I would like to call on our favorite anchor and moderator, Miss Karen Davila. Right. Sure.
There I am. Can you hear me now?
Very clear.
All right. So I want to thank all of you for having me here. And I personally want to thank Joey for inviting me, as always, for his trust, his confidence. And I want to congratulate the team for all the work that you've done. I want to introduce to you 5 of our panelists who will be discussing the critical components of effective overall health management, such as health and safety measures, testing, data mapping, tracing, and health infrastructure. Each of the panelists will make a presentation and we'll have a forum after all the panelists have spoken. I'd like to encourage the panelists to please keep their presentation brief and direct to the point so we can hear questions from our audience as well. Let's start off first with Congressman Joey Salceda, a representative of the 2nd District of Albay. Congressman Joey, good morning to you. All right, Congressman Joey Salceda, are you there? Can you hear us? Okay, while we're waiting for Congressman Joey Salceda, as you can see on your screen, it's actually okay to put up his presentation on the screen already. But Joey, if you can hear me,
Yes,
please
okay.
just speak.
I'll just stick to the first page.
All right, go ahead, Joey.
Um, First page lang, Sardi. So basically, the main takeaway is that if you study all past crises over the past 30 years, you can almost say that it's all about confidence. And in the case that we are facing right now, it's about one, the healthcare capacity. In other words, we are at that level where ensuring that we have the capacity to take care of any possible spikes should already be in place. Second, it's about putting children in school. And third, last and before that, essentially it's about transportation. And the second one is my message is that we should focus on the secular trends of the Philippines. Focus on mid 2021. I'm sure there will be a vaccine, and therefore there will be more scope for determined recovery. And if you look at the Philippines, we have the lowest median age of 23.9. That is our biggest. I think Thailand is 34. We compare it to the US or China, which is about 48. So the Philippines, I'm not saying this to make people feel more complacent. We have room to make mistakes. And second, third, the country is economically resilient. And it's always, our GDP is always 4% above global average, except probably for this one, kasi OA tayo nag-lockdown. And then, of course, we have a robust flow of structural reforms, and most of them are already in the Senate. They've long been passed in the House. And there's now that ongoing debate about keeping the powder dry instead of, going for a stimulus that will take advantage of opportunities for quick recovery. Apparently, our economic managers have taken a long view that this will be a long fight. So we have to keep our powder dry. The position of Congress that we will keep on producing the powder through revenue measures, essentially. And lastly, there are structural reforms, which are all again pending in the Senate virtually. And this could essentially put the Philippines, the Philippine story, essentially still one of the most exciting. And lastly, we should seize the low-lying fruits in front of many of us in terms of digitization, in terms of our capacity in TESDA, realignment towards BPO, of course, putting credit remediation, especially for SMEs. I think at no time in the history of this country has SME been seen as its critical role, wherein they account for 13% of GDP, but they actually account for 60% of employment. And therefore, virtually all the strategies being put in place by the government is centered around the concept of SME. So that's all. Thank you.
All right. Thank you so much, Joey, for that. A short but actually very clear, makes a lot of material for our discussion later on. I'll go straight now to Congresswoman Janet Garin. And Congresswoman Janet Garin is the RPCR Private Sector Chief Implementer, and she is the representative of District 1 of Iloilo. Congresswoman Garin.
Thank you very much, Karen. Let me quickly share a few slides.
Okay.
Okay. Project ARC, the PCR initiative, is actually the following objectives. First, making testing affordable, available, and accessible. This has been very successful. We were able to reduce the cost of PCR testing to around 1,500 to 2,000 pesos. However, there is a need for further reduction to around 350 to 375 pesos. And the target for this implementation is end of July via a pooled testing mechanism, which The Philippine Society of Pathologists, together with Dr. Ray Law, who is with us today, the principal investigator, is working on. A baseline PCR testing is recommended among vulnerable workplaces to update everybody. The Go Negosyo Research 1 will be followed by 6 researches that will cover Makati, Mandaluyong, Cebu, Zamboanga, Cebu, the House of Representatives, the OFWs, BPOs, supermarkets, and construction workers. Those will be the initial targets of application for the output of the research and pooled testing. A retest is recommended once an employee displays symptoms, but a regular testing on a monthly basis will quite be expensive and it will be taxing on the part of our laboratories. And this will also allow targeted and selective quarantine measures in the workplace. Next slide, please. Next slide, please. Okay. Just to recap, Dr. Raylaw can expand on this more. The intention of the pooled PCR testing is to allow us to balance public health and the economy. We cannot afford a second lockdown, and reducing the workload on our laboratory staff is paramount as of this point of time. It will also give the LGUs and the businesses a better and clearer direction, and will allow us, most importantly, to sustain the gains of the initial lockdown. This might be a little bit late. We had a lot of nuances in terms of bureaucratic approvals, but what we are seeing now is that everybody is joining forces for us to achieve what we need to achieve. And we all agree that when a workplace becomes infected, exposed, operations has to be suspended. Many wouldn't understand that this actually means loss of income, a difficult life, and small businesses closing down. The debate has been very extensive when people were asking us, why do you have to choose livelihood? Where in fact we have to, life is more important than livelihood. Actually, we have to balance both because we are ending up now with a lot of morbidities and mortalities due to non-COVID illnesses. The purpose of the Go Negosyo Project Arc PCR initiative is to allow health and economy to meet, because it is only in testing that we can fill the gap in making social distancing, hygiene practices, and other new normal behaviors more effective. Pooled testing can actually allow us to coexist with COVID. Thank you very much. Back to you, Karen.
All right. Thank you so much, Congresswoman Garin. And just a clarification, this is also, Congresswoman, for everybody watching. The description that you just gave is for PCR swab testing.
Yes, ma'am.
Oo, hindi po ito rapid testing for our viewers this morning.
Yes, it's PCR pooled testing.
All right.
Go
ahead.
Depending on the sector. Like if we will be coming out with recommendations, whether a specific sector, probably in the health sector, we're looking at pools of 5. In the supermarkets, we're looking at possibility of pools of 10s. In the BPOs and other factories, it can probably be a pool of 20.
All right. So we'll get back to that. Okay. Dr. Garin will get back to that. Let's now go to Gisela Concepcion. She's the president of the Philippine American Academy of Science and Engineering. Gisela, good morning to you.
Good morning, Karen. Can we flash the slides, please? So, good morning, everyone. The Philippine American Academy of Science and Engineering consists of about 400 scientists and engineers of Philippine descent based in the Philippines and the United States and the rest of the world. And we normally scour or survey the scientific literature for a lot of topics, but in particular, we have focused on COVID-19 since the onset of COVID-19. To the left, you will have a photo of the virus. This is our enemy. And you will see that the SARS-CoV-2 virus is about the same size as influenza. And on the left, you'll see the size of a human hair filament. Okay, so just telling you that this is the invisible enemy that we are fighting. It's much smaller. And so the basic strategy is to protect ourselves from this virus through our masks. Now, it's not just a naked virus that we're fighting, it's a virus that is in a droplet, okay, that's airborne or that's, well, entered our nostrils or our mouth. And it could be in a respiratory fluid that is emitted out when you breathe, speak, shout, and socialize. Okay, so I think we know what the basics are regarding trying to get this virus from being transmitted to our other people. So I'll now move to the next slide, which is really a summary of all the things that we in PASE have tried to address. And this is in the form of PASE bulletins. There's 17 of them on 3 major topics. First, containment and mitigation. Second is triage and treatment. And third, the mass testing and fast tracking. And when I got the outline of Balik Kabuhayan, I said, this is perfect. And I would like to just reiterate some of the points that we've made in our bulletins, which are based on scientific publications, and not just on clinical trials, but also on biochemical and other types of studies. So return to work and mass transport, I added mass transport. I think we have it clearly stated by Joey Concepcion that we need essential on-the-ground workforce back. And we further limited this to the healthy individuals, 20 to 50 years old, definitely not senior citizens, those with no COVID-19 contact, no comorbidities like cardiovascular disease, diabetes, cancer, etc., no high-risk condition like a pregnancy, asymptomatic over a period of time that you are quarantined, and many of us have been quarantined for 3 months. I'm sure the MSMEs have been monitoring their employees as having quarantined and being asymptomatic. And then we have the negative test results. We then follow exercise, physical and social distancing in the workplace, and also a staggered low density work schedule and seating in the workplace and the vehicle. And I'd like to emphasize mass transport here. There is a group of scientists and MDs who have come up with a document on guidelines for mass transport. And I think this is important because this is what links the workplace of the SMSE to the homes of the employees. And in this way, with distancing and all other measures we want to implement, the employee, the SMSE, has an opportunity to educate the rest of the family of the employees. Now for testing, I think the most important would be your clinical symptoms test, but then we do have the rapid test and the RT-PCR gold standard test. And in PASE, we emphasized the need to use only those brands with high performance specifications. For sampling, we need to have a good method, and the pathologists and the med techs that they supervise know this well. And also there have been RT-PCR testing centers that have been set up, including ones in UP, the Philippine Genome Center, and the UP Los Baños testing centers. And they have the capability to train more of our scientists, researchers, and technicians for RT-PCR testing. Good sample pooling design that will be discussed by Dr. Raymond Law. And I also adhere to this periodic multi-time point testing that would catch the course of the disease from asymptomatic to pre-symptomatic to symptomatic stages of an individual, because the response of an individual is different or unique from other individuals. This would be administered by a health worker, and then there would have to be this facility for quarantining of positives. Now, I'd like to move to protection, hygiene, nutrition, immune boosting, prophylaxis, and treatment, because this is where the MSMEs can also make a big difference with their own investments, with help from ARC and from Go Negosyo and from the government.
I can include you. You want to watch?
And this is where I think PPP, private-public partnerships, are
And the
very
panel.
important. First is education, signages, flyers, seminars, constant reminders on best practices in the workplace. And this is then transmitted to the homes of the employees. Then we already know mask, entry, shoe bath, surface disinfectants. And then now there's like literature on the use of gargles, like those with iodine. So we all know, iodine really kills or denatures proteins. So betadine, povidone, and the very, very abundant salt or saline gargle is also used in cases. Okay, it could be for the nose as well as for the mouth. Excuse me. We have to emphasize good ventilation, dry, clean air exchange in the workplace. And this is very important, healthy, balanced green fish and fish diet. And there is a lot of literature now on a fish oil or EPA, omega-3 diet that helps mitigate or reduce the incidence of cytokine storm and sepsis, inflammation, cytokine storm and sepsis. We know vitamins, minerals, and food supplements are important. I wish that the MSMEs would invest additionally on the food supplements and vitamins, minerals of the employees. There is recent report from a very prestigious journal. It's called the Proceedings of the National Academies of Science of the United States, that the BCG-TB vaccine is showing to make a difference, but then we will wait for the completion of the clinical trials. But then this is a case of what I would say measuring the cost, harm, or risk to benefit of such an intervention. And we know that we have stockpiles of BCG vaccine. We need it for our toddlers, our infants, but then in situations like this, we might consider stockpiling some more on our BCG vaccine while waiting for the COVID-specific vaccine. If you want to know more about this, I can share with you the publications. Then there's hydroxychloroquine, zinc, azithromycin, and steroids. We know very well that some groups have debunked hydroxychloroquine as a treatment, but then if you get the information from some of our leading hospitals here in Metro Manila, you know that early stage COVID patients responded well to HTQ with zinc and azithromycin. And there is now new publications indicating that a group considers that if you time the treatment of hydroxychloroquine to the early stage, and this is something that you would catch because of the massive testing that's being done, then it might become useful. Again, a stockpile of HTQ would be good. It's readily available and very affordable. Goals, attitudes, and mindset, MSEs as transformative agents in society. So I think in the workplace, you need to do psychological and physical health and welfare seminars, then those to simplify the lifestyle and aspirations, and also to focus on sufficient productivity to earn a living and provide healthy, quality goods for society. Okay, that will be good for the environment. Let's not be too ambitious about bringing, back the economy all the way to top level. Maybe focus first on those priorities that would give our society healthy food and also be good for our environment. I think I'd be referring as well to the circular economy here. For contact tracing and physical distancing tracking, we are aware that the LGU hospital reporting system, or apps for contact tracing, uses currently the multi-SIS app, which is the only one endorsed by the DICT. But then I think what's more important is to get the LGU or LGU hospital-based contact tracer competent. Then there must be a constant monitoring of the constant tracer of COVID-19 positive individuals. There's going to be a close coordination of contact tracer with LGU hospital team in charge of symptoms monitoring, testing, and quarantine. And in the future, there's foreign-based wristband digital trackers worn by community members, which records close contact with infected individuals, but also monitors physical distancing. Now, example would be confirmed infected individual given a wristband at the testing center, e.g. returning OFW tested positive at the airport who goes back to his locality. Data mapping, there you have this big operation that is led by the DOH, OCD, and the ICT. Health and infrastructure, I think the government is trying to address this, but in particular, I'd like to point again the guidelines and training for treatment and the stockpile of prophylactics like vaccines and drugs and low-cost ventilators. So there were two groups in the PASE that are trying to develop low-cost ventilators like CPAP-based or pediatric ventilator-based. So this would be a useful, say, for the triage, for the different stages, the early stage, the middle stage, not the ICU stage. But then when we asked, we conveyed this to the DOH, and we have been in contact with the DOH, the DOST, and the private sector as well. Then there was no interest at that point. But I think with the upsurge of the COVID cases, this must be considered. Okay, finally, economic stimulus and recovery package. I think that the basics that you are providing now, it's good, but it would be important to provide financial incentives and technological training and support for MSMEs to reinvent their products and processes. And in particular, we have a PASE expert who is into 3D printing and additive manufacturing that would make a major contribution to transforming agriculture and related businesses in the provinces. So this is all I wanted to share with you. If you wanted to ask for experts from PASE, we will readily connect you with them. Thank you very much.
All right, thank you very much, Dr. Giselle. I just want to say that there are so many questions already on our chat thread for you, and you've given so many interesting points that we can all learn from. I'll be asking you about that later on during the panel. Let's hear from Raymond Lo. He is the former vice president of the Philippine Society of Pathologists and head of Philippine Children's Medical Testing Laboratory. Raymond, good morning.
Good morning. Thank you for the invitation to speak here. The Philippine Society of Pathologists, and I would like to give you what we can share in terms of contributing to this fight against COVID virus. Early on, the DOH policy on testing had been restrictive simply because there was limited capacity to test. But we had strategized to allow our laboratories to expand testing capacity by this pooling system. So very recently, the DOH policy has now been revised to include asymptomatic populations for testing, which includes frontliners in healthcare, tourism, transport, factory workers, etc. So ideally, this extensive testing should be conducted on these asymptomatic populations at high risk of contracting the virus, since it has been shown conclusively that asymptomatic persons have the capacity to spread the virus, especially in super spreader events like choir singing, parties, close work contact, and similar indoor events. Now, expanded testing strategies can cover testing for those populations. It can be shown to be efficient, accurate, economical, and can produce results in a short period of time. Our research on pool testing seeks these concerns, which is shown in slide 1. Currently, we are conducting a preliminary study to determine if sample pools of 5, 10, and 20 can detect low levels of virus in a single sample within the pool without losing sensitivity or the tendency to produce a false negative result. As you can see, this pool testing will really expand our capacity to test more people. So can I proceed to slide 2, please? This is simply a cartoon of what pool testing will be. Okay, so in here we have 10 samples which will be pulled into one run, the RT-PCR run. And once this is done and everything, if this is this single sample is negative, then all the samples, the 10 samples, will be considered negative. But if one of them tests positive, we can now test for subpools of 5, for example. And once we have a negative result for one subpool, that 5 samples now can be released as negative. So that will be faster release of samples of at least 15 persons tested. The positive pool will now be tested in individually positive results. So in the best case scenario, we will be saving 9 tests for testing 10 people. And in the worst case scenario, we will be using 8 tests for a positive sample in that particular run. Phase 1 is currently underway and should be finished within 1 week after study approval by the Institutional Review Board of the RITM. And phase 2 will be done once phase 1 is over and it is proven to be sensitive enough. We will now attempt to implement the pooling method in the sizes that phase 1 indicates will be sensitive enough. So what is phase 2? Phase 2 is simply using the sample pools that have been proven to be sensitive enough, and therefore this will be done within 2 weeks after phase 1. And as soon as the results are available, it can be rolled out to the other laboratories to drastically expand testing capacities and savings in reagent costs, and can be from 50 to 80% depending on the prevalence of infection. We are projecting a prevalence of 5% in the Philippines, and that is really an overestimate, I believe, and that's a general belief of our society as well. Now, it can definitely be a game changer because it will lower costs. There will be speed in reporting and ability to test maybe possibly 10 times or more the current capacity of our labs. Now, can we have slide 3, please? While no best testing strategy at the moment, we definitely cannot keep on indefinitely testing our people for RT-PCR. Simply because it is very labor intensive, we will exhaust our health personnel and our reagent stock as well. So our society has recommended the algorithmic testing strategy combining RT-PCR and machine-based automated antibody testing that are suitable for mass screening. These tests can detect recent and past infections, allowing us to see a broader picture of COVID-19 infections in our population. It is a longer-term strategy to determine not just current infections, those that are RT-PCR positive or total antibody positive, IgG negative, as on the left side, and but also recovered cases, in which case these are people who are only IgG positive, who need not be repeatedly PCR tested. This strategy will give us a sense of how and where the infection has spread, and if we see enough of the population has recovered, we can assume herd immunity and stop testing these populations. I was just reading earlier this morning about an article that concerns herd immunity, and one mathematician estimates that perhaps even less than 20% recovery can be a basis for herd immunity, while others have a more conservative estimate of 35 to 45%. Nonetheless, these are figures that may not be achievable at the moment, but we need to make sure that we are looking out for that particular moment in time when we can stop testing. For depressed and vulnerable communities, we can implement pool testing of all persons in the community while it is under total lockdown in case we have these targeted lockdowns. We identify the positives, isolate and quarantine them and their contacts until the outbreak is contained. I will just talk about briefly the health infrastructure. For those who are vulnerable, staying home is the best way to avoid getting sick and in turn reduce the strain on our healthcare system. For the able-bodied working population, strict observance of mask wearing, social distancing, avoiding crowds, and undergoing periodic testing will help in preventing further spread. We can also implement the pooling testing method to expand testing capacity, and we can put out more of these RT-PCR labs to better manage the large volumes of persons tested. So at the moment, that is all I have to say. I'll be happy to answer questions later. Thank you very much.
All right, thank you very much, sir. That was Raymond Law. And our last panelist is Josephine Gutiano Niap, President and CEO of Philinvest Development Corporation. After this presentation, we now go into a panel discussion, and we're getting questions also from our audience and those who have already submitted questions earlier. Ma'am Josephine, please go ahead.
I think also representative from the private sector. The role in private sector is to balance four things: the safety and livelihoods of our corporate families, the needs of our customers, for our Philinvest families, our program revolves around testing, hygiene protocols, and contact tracing. We started by conducting a health survey to do a risk assessment. It allowed us to understand the exposure and infection risk based on the living and working conditions of our staff. Higher contagion risk positions required rapid testing for return to work and more frequent testing. We are looking forward to the launch of this testing and expanding testing protocols, as this is the only way we can conduct regular testing of asymptomatic frontliners using PCR tests. I think the slides are We have developed an app to report corporate testing and can produce the required DOH report. It's important for companies to report to the DOH to help them in their data analytics. We constantly communicate to our team that we cannot clean every place every day.
Wait lang. Nanap ko siya.
So the responsibility is in their hands.
Nahanap mo siya? Na-mute mo siya? Tinatawag mo ko si Mami.
Yeah. Hello.
We do regular cleaning and apply an antiviral coating on surfaces that are frequently touched, like doorknobs and vacuum counters. No eating in groups, and we require closing the toilet lid before flushing. We organize shuttles and carpools to minimize computer risk, and we require daily thermal screening and daily health reporting to stay safe. For contact For contact tracing, we require the use of stay safe in our workplace. Stay safe allows us to easily.
We cannot hear you.
It keeps on turning off. Uh, for contact tracing, we use stay safe. It allows us to trace.
Hello. Okay.
Yes.
Ma'am Josephine, this is Karen Davila. Um, there's feedback going on, so I want to ask you because they were trying to fix it, so I didn't say anything. Is there anything in your room right now where the audio is on? Do you have another computer there, or is your laptop?
I turned everything off now.
Ah, you did. Okay, because it's clearly coming from your end. You don't have an earpiece.
Gian.
You don't have an AirPod or an ear. You don't have earphones, ma'am.
Tawagan mo si Karen. I-cue mo si Karen kaagad.
Okay.
After
All
this,
right.
George.
Okay. Maybe. All right. So we'll have Ma'am Josephine first fix her setup, and then can we go back to me already so I can start the panel at least with some of our.
Karen?
We can start the panel. Yes,
Hello.
I'm here.
Karen,
I'm
this
here.
is Dr. Mingita Padilla. I'm supposed to give
Yes.
a synopsis and summary first.
All right. Okay, madam.
I'm the last
Please
speaker,
go ahead.
actually.
It
Okay.
says kasi on my script. What it
Yes.
says on my script is
Yes.
the panel
Oh.
goes first, and then your
Oh.
synthesis is last.
Oh.
What
what
do
do
you
you-
suggest?
I don't know. What do you think? What's the
I
preference
think we
of
should go
everyone?
with the panel first.
Okay, sure. Yeah,
And then
that would
it
be
says
nice.
your synthesis, Dr. Mangita, you're the
Okay.
end.
Okay.
You're the wrap up.
Okay. That's okay,
Okay.
then. Okay, bye-bye.
All
See you
right.
later.
Okay, thank you.
Bye-bye.
See you, ma'am. Okay, so I'll start already. Can you put already first the panelists on screen? Okay, Josephine, can you turn on your mic? I just want to see how you are.
Yes.
Oh, you still have feedback. That's quite
Yeah,
interesting. Yeah.
I'm all the way in Singapore, so I don't know if.
Oh, maybe. It could
Yeah.
be that is a possibility in terms maybe of the Wi-Fi or the signal. Okay.
Just go ahead with the panel for their
First,
Q&A.
all right. Okay, and then you can join in, ma'am. All right. Can I see Joey Salceda? Are you on? Joey, Congressman Joey, Congressman Janet, you're in. Gisela and Raymond. I'll start first with Gisela Concepcion. I think you've said very interesting aspects in your presentation earlier. And I want to ask you, let's simplify and start first. Okay. Questions. First, is COVID airborne? Has that been proven, Gisela, that COVID, is it airborne? Your microphone, ma'am.
Definitely airborne. Yes.
Definitely airborne. Okay, go on.
That's it. So what happens is an infected patient speaks, breathes out, coughs, shouts, and some of the mucous membrane that contains the virus comes out. Okay, so depending on the activity, it could be a smaller particle or a bigger particle, and the smaller particles remain suspended in the air longer, and then they start to settle, and they can get to your hands, to your face, to your surface.
Okay. And this has been proven, Dr. Gisela, because the reason I'm reiterating is there was a period that coming from the media that it was corrected over and over that COVID wasn't airborne. It is only through droplets. That's why social distancing was encouraged for a meter. So now, okay, it is airborne. How long does it stay airborne? How long is it there?
So the droplets are, transmitted through the air. So I don't think there's a conflict between, saying that it's airborne and it is, in the droplets. So it depends. So if you get the shouting or the coughing, then the distance that it travels is longer. Speaking and breathing out, it would be shorter, and the droplets could be smaller. And then that really
Yeah.
takes hours. There's scientific publications on how long they stay airborne and how long they stay on surfaces.
Okay, but Madam, I'm sorry to ask you this. The reason it's important to clarify is I'm reading right now from the World Health Organization, published March 29, World Health verified site fact, COVID-19 is not airborne. The coronavirus is mainly transmitted through droplets generated when an infected person coughs, sneezes, or speaks. So the World Health Organization doesn't define it as airborne as of today.
I think it's semantics. Obviously,
Okay.
it's just semantics.
May I say something, Karen? Giselle?
Yes, please,
Yeah.
go ahead.
I want to add to
Who is this?
Miss Mingita, Dr. Padilla.
Okay.
Okay, I have
Yes.
to explain because it's aerosolized. Okay, when you cough, when you sneeze, when you sing loudly, your saliva goes out. It's aerosolized. There's a difference between really airborne, as though I'm standing here 20 feet away.
Yes.
I talk and it's going to be 20 feet away. No, it's that's why it might make people panic naman too much. You have to clarify and what airborne means. No, it is in the air, but
So
it's
is it aerosol, not
aerosolization.
airborne?
It's more.
Is it?
Aerosolization, yeah, but you have to clarify.
Yes.
Like, for example, you're intubating a patient, anesthesia, then it's aerosolized. Then definitely there's a high risk. If you're in a bar, that's why the bars are very notorious. You're in a bar, you're drinking, people are laughing, talking, singing in a karaoke bar. It is aerosolized. And it's not the same as walking in your garden or in the road, no, with very few people around. The risk is very low. So I think people have to, how do you call this? Have to clarify what you mean by airborne. It is in the air, but not everywhere, you know? It's not like in the air we breathe just because there's one person who lives nearby. No, there has to be a certain situation where it's aerosolized, you know, so a certain distance. So I'm not here to say exactly how much distance, but we cannot naman make people so paranoid that they can't even go out, diba? I think Giselle has, I think that's what Karen was trying to,
Yeah.
really all over the air, or is it in certain situations? Where it
Okay,
is
maybe.
Yeah.
Okay, that's a good point, Dr. Padilla. What about Dr. Garin, Congressman and also a doctor, very quickly? How would you describe it already, Dr. Garin?
In the situation, it's not airborne as the layman perceive it,
Yes.
but it can stay in the environment for some time. That's why it's very important to still practice physical distancing, and some of the activities are prohibited. In the Philippines, when we say airborne, people would usually coin it with measles, wherein one infection in a certain room can infect 17 others. Hindi po ganoon yun. And tuberculosis is another virus.
Yes.
Perceived to be airborne. COVID is respiratory droplets that can be aerosolized depending on the situation. That's why it's very important for the healthcare providers and the frontliners to be tested regularly, because they are highly exposed. And their exposure, they can be infected via aerosol transmission, but when they infect their patients, it's via respiratory droplets.
All right, thank you. Maybe also Dr. Law, one of our panelists. I'm asking all the doctors in the panel first. You can comment, sir, on that.
Yes, I agree with Dr. Mingita and Dr. Janet about the droplets as well as the aerosolization. It's all situation specific. If you are in an enclosed room, at close range, not wearing masks, certainly you will inhale a lot of the other person's droplets or even aerosol. When you are outdoors, the odds are you will not be inhaling any droplets or aerosol simply because you're far enough, and the droplets and aerosol dissipate faster in outdoor situations. So no need to panic, but we need to be careful. We need to keep wearing a mask, and we need to have distancing between people, especially I notice in hospital staff rooms where they eat together. And we ban that because that has been the source of, communal infections within that community.
All right. Thank you, Dr. Law. Dr. Giselle, just going back to you also, maybe you can reply to that, but also very quickly, in your presentation, you mentioned hydroxychloroquine, zinc, azithromycin, and steroids, which I find quite interesting because the WHO has outright discouraged the use of hydroxychloroquine. So I think the DOH has stopped using this in the Philippines. And I wanted to ask you why Avigan is not included in your presentation.
So in the case of hydroxychloroquine, I say that there are publications now that still assert that there have been a significant number of patients in the early stage of COVID who have responded to it. And from the biochemical standpoint, we understand why this may be so. And when it is administered with zinc, okay, it chaperones or it carries the zinc inside to kill the cells infected with the virus. So I say that scientists, we keep an open mind, and it is our role to alert the other medical scientists and doctors and the community about what the rest of the world is learning from their own researchers. So I say we keep an open mind. And in regard to Avigan, I think it is not as readily available here as hydroxychloroquine might be. And that is what I say would be a risk cost to benefit judgment to be made by you know, the ones who are deciding on what to invest in. So that's
okay.
So keep an eye on that. Yes.
All right. Okay. I'd like to open the next question to all our panelists and even Congressman. I read your question, George. I'll ask that. Even Congressman Joey Salceda can answer. This is open to all the panelists. Why is it that in the Philippines, unlike other Asian countries, there are 0 deaths? Yes, the numbers of COVID may be growing, but they were able to control the deaths. Are we able to explain this also in terms of our health capacity, even our healthcare capacity, how we treat patients? Can anybody would like to respond to that?
I don't understand. Karen, your question is how come they have no deaths and we have deaths, or we have no deaths?
Yes, other countries are able to control deaths.
We have higher death rate than them.
Yes. Please go ahead, Dr. Padilla, all the doctors, anybody also from ARC that would like to speak. Go ahead, Dr. Padilla.
It's not
in terms also of challenges that we have.
Yeah. It's not a very simple question to answer. It's very complex because death is due to so many things. One reason could be sometimes it's late in the game when they seek medical help, which is a very Filipino thing. No, it's also because probably the testing of asymptomatics has not been that great the way it has been in other countries. Thailand. One of the things they did is they went around. They closed, and I'm really sorry I have to say this. They closed their borders very early on. January pa lang, they closed their borders. They did contact tracing very early on when they had their first COVID patient. You're talking about Thailand. Why? No? Then they went around to the communities and started testing also very early on. So from the very start, they had na tayo ng konti. No? Now, another thing that can increase death is, I think now our death rate has gone down. In fairness, it was higher in March and April, but lately we have more patients because I'm also connected with PGH. I have friends I work in a hospital. I have friends in San Lazaro. No? We have more patients in their 20 to 40 age group because we opened up the economy. But the death rate has also gone down. No? We have greater contagiousness, there's more infectiousness, but less virulence naman. The ones who are dying now, or the ones in the ICUs, are the ones who are elderly and who have comorbidities. So death is a very complex thing. No? We can talk the whole day about it, but those are just some factors which may be the reason why we still have a fairly high death rate. But currently it is going down, the death rate. No? But death is not everything. There's also morbidity in those who have the disease and have long-term effects. So it's not everything.
Okay. All right. Congresswoman Garin, would you like to add in? And you can relate it to your presentation earlier today, where you talked about the need for further reduction also in the price of our PCR tests and how pooled PCR testing can actually help in this situation.
Thank you very much, Karen. I can attribute the higher number of deaths as compared to other countries to four factors. First, testing when it first became available was very expensive in our country, and it was not readily available. The focus was you had to have symptoms first before you can be tested. Unfortunately, the mortalities that we saw were actually asymptomatic on the initial stage, but because they have a lot of comorbidities, they had diabetes, and many of those who had mortalities, if you look at the mortalities, many of them are actually diabetics. So they go to the hospital at a very late stage simply because they were not tested, because they were asymptomatic. Next, another issue was the issue on home quarantine. When we allowed home quarantine, which was actually the lesson learned in Wuhan and in Europe, and they were very vocal in advising all the other countries that we should not resort to home quarantine. Nagkaroon po kasi ng kumpiyansa. Many of the patients who stayed at home thought that it was just a minor thing, and when they seek consult, it's already at the late stage where oxygenation and co-infections already exist. Third, we don't have a high rate of pneumonia vaccination, even among senior citizens. This was supposed to be free. However, the implementation process failed to educate the public that it should be given in 2 doses 5 years apart. Many are confused between a flu vaccine and pneumonia vaccine. So we have a lot of COVID patients that when they go into the hospital, napapasukan na ng lahat ng viruses and other bacteria. So they have other pneumonia and severe pneumonia. The COVID virus goes away. The patient ends up with a lot of complicated situations brought about by other new viruses and bacteria causing pneumonia. And then the patient goes into renal failure, and then they go into systemic organ failure. The last issue is actually an issue of management, patient management. Since this is very new, it's a novel virus, management of patients comes on a case-to-case basis. There's no hard, fast rule. Many would say, oh, ito ang dapat gawin. But if you really look at the patients, if you talk to infectious disease specialists, you have to handle the patient on a case-to-case basis. And the cascading of treatment protocols, management protocols, was not that fast because people were too careful on conveying the correct information. But this is not unusual for other countries. This usually starts on a country like the Philippines. Is a lot of islands. It's not that easy to bring specialists from one area to another area. But moving forward, if we do aggressive testing, immediate isolation, no home quarantine, and vaccination against pneumonia, we will have less deaths in a better direction.
Wow, that's quite clear. Okay, I'll ask Dr. Raymond Law, also Gisela, and also Josephine, if your signal's good. I'd like to say Joey Salceda, he's already disconnected from us this morning, but I'd like to catch on with what Congresswoman Garin said at last. Dr. Law, she mentioned Dr. Garin, I want to catch that. You said a pneumonia shot. You said, right? What did you say in the end? You said 3 things.
Pneumonia, especially for those with comorbidities, and even a flu shot for the frontliners. Early testing so that we can have early isolation, and no to home quarantine.
Okay. No to home quarantine, or you don't want home quarantine?
Yes. If you observe Wuhan and even Europe, their experts and their infectious disease specialists have been telling the whole world that was one of their major mistakes. When they allowed home quarantine, it's not as effective as if you did isolation of even mild or asymptomatic patients in a quarantine center. What we actually did is that we converted many of the quarantine centers to swabbing centers. That will be good for now. But once we have extensive testing, all positive patients should be in isolation center because this is a new virus. There are a lot of unknowns. we cannot risk. There are a lot of transmission happening in the community. And this is because of super spreaders, of asymptomatic carriers. And putting
all right.
in their homes allow them to transmit it not only to their household, but also to the other people who interacts with them.
Okay. Okay. Well, this is all very fresh, even to someone like me who interviews the Department of Health all the time. Really, I'm having an aha moment here, and I hope our viewers are getting information and they're writing it down. Dr. Raymond Law, Gisela, please feel free to add. Do you agree with this, Dr. Raymond Law? Any other aspects that we should add on to essentially just coexist with COVID is the word?
Yeah.
Okay. Definitely agree with everything that's been said. But mind you, we are getting better in treating this as our clinicians gather more experience with their patients and find more effective strategies to contain the virus in their patients. Now, we also benefit from the previous deaths of these patients because some of them have been autopsied and now understood the pathophysiology of the infection, which is widespread clotting or coagulation of blood within the organs of these patients that lead to their deaths. Definitely, we can manage this cytokine storms better now with dexamethasone and other monoclonal antibodies that's being used recently. So convalescent plasma therapy is also a good way of treating our patients. It's an age-old remedy. It's been with us for over 100 years. It simply means that you collect the plasma of the recovered patients and transfuse them into severely ill patients who will manifest very good improvement within 7 days. Some of them manage to get off intubation after 2 weeks. And as you know, when early on, when you were ill for COVID, you have a 90% chance of dying from it. Now, with these therapies, we have less than 1% mortality from the years.
Okay. No, that's brilliant and very optimistic. It gives us hope, frankly, because fear has overtaken everyone. And I think this is why Joey did this, is because when Joey was fighting for the reopening of the economy, fear was the hard argument to deal with in the whole discussion with the cabinet as well. Okay, Gisela, before I call you again, and also Josephine, DOST Secretary Boy de la Peña is with us this morning. Secretary de la Peña, I can't see you, but hello. Where are you, sir? Secretary de la Peña, can you hear me? Okay. He's not responding, so let me call on Secretary de la Peña.
Yeah.
All
I just
right,
wanted
go ahead, sir.
I just wanted to add something. This is not original, but I heard this from a report that was done, I think, by DOH. Why, for example, Vietnam has 0 death.
Absolutely.
Recorded.
I asked that earlier, but go ahead.
And the explanation, although it was not too firm, was that in their case, they report the immediate cause of death. So if it is pneumonia, they report it as death from pneumonia and not from COVID-19. Yun lang ang gusto ko idagdag.
Hindi, malaking bagay po yun, Secretary, no? So parang ang lumalabas, hindi intentional, but it could be unintentionally dishonest. Pwedeng COVID yun, except naka-record na iba.
Kung ano yung immediate cause of death, nire-record.
We all know that ang COVID can cause many complications.
Correct. Yun lang. So that's what I heard. Kaya nagtataka rin ako, but Vietnam, which is a very big population, has still 0 death.
Exactly. Okay. All right. I'd like to go
yun
back.
Yun lang.
Okay. Pero, sir, please feel free to speak anytime. Just
I think magaganda yung explanation ng ating mga doktora.
Opo, opo. Okay, I'd like to call in again, Miss Josephine. Are you still there?
Yes, yes,
Josephine
I
from
am.
Singapore.
Yes,
Okay.
hi.
Yes. Would you like to add anything, Josephine? How is your audio now?
Can you hear me well now?
All right. Okay. Very good. Yes. We
Yeah.
can talk about yeah, go.
Yes, there are three things I'd like to add. My husband is the ambassador to Singapore, and so I know a bit about what's happening here in Singapore. While our death rate is still better though than a lot of the Western economies, but compared to some of the Asian economies, we're far behind. And the reason for that is some of them have gone through SARS. So like in the case of Singapore, where they went through SARS, they already have a very robust infectious disease healthcare system. So they have a hospital with 1,000 isolation beds and all the very special equipment, which we did not have a chance to build up that type of a robust infectious disease system. Secondly, some of the countries have a contact tracing protocol, which we are having difficulty doing because there's a lot of complaints about data privacy, etc. Right? For example, in Korea, they can go to your telco and they know every place that you've been to. They can even look at all of your banking transactions to know all the stores that you went through to do contact tracing. So they have a very, very strong contact tracing system as well there. And then thirdly, if I'm not, the others can correct me, but I have the impression that we do not have a centralized CDC, not unlike other countries who oversee the infectious disease, and that the centralized CDC will oversee a network of epi doctors all around the nation, nationwide. I believe our healthcare system, to some degree, they're under some of the LGUs, etc. They're not under one central CDC.
Okay,
that's it.
I see. Yeah, so that makes a big difference already. Okay, Giselle, yeah, Dr. Concepcion, yes, please go ahead.
Say something. I think the great thing about ARC is that you are getting the good data. So we need to get the data, and it's got to be good. And so we provided some advice on what the best test kits are. Okay. And while there are some in the medical community who do not advocate rat testing, so some would say, no, we should try it. Just use the best kits, and let's see what the data we get from a great number of individuals tested. And so now I think there's very valuable information there that we could work with. And then we have Dr. Law, who will start his sample pooling experiments and then use that basis for getting even more data. Because many of our data are from foreign countries. But we need to work on our own data and see whether the sensitivity and specificity numbers of those kits work or not. Okay.
Okay. All right. Thank you, Dr. Concepcion. To all our participants right now, there's already a clamor for me to move to Balik Kabuhayan question, MSME's question. But let me just ask very briefly, just to end the health question, some practical questions here that you all can answer yes or no to the doctors in the room. Something simple. Or should they open the windows instead of use the aircon? Yes or no?
Karen,
any doctor? Yes.
Karen, in the hospital or in the clinic, we open the window. But you can still use your air conditioner. Just open the window. Because
number
hot.
Okay.
And have an exhaust in the room. An exhaust in the room is also helpful. Exhaust.
Okay. All right. Now, do air purifiers work? UVC, these HEPA filters? Very quick question. Yes or no?
It would help. The HEPA filters would help. So it depends on the pore size of the filter relative to the size of the virus in the droplet.
Okay. Somebody wants to join the pool testing. How is that possible, Dr. Garin, very quickly?
We will cascade it by end of this month For Go Negosyo partners, there's a system that you have to log on and email. We'll cascade it by the end of the month.
Okay, cascading end of the month. All right. Next, we'll move on now to the MSME's question. I'll go directly. Joey, are you there? Can you hear me?
Yeah, I'm here. I'm here.
Okay, the questions, I'll just go direct to the point. Some questions on business here. Okay, it was for Congressman Salcedo. You mentioned credit remediation for SMEs. Are there any current plans or initiatives towards that regard? Cash flow is a problem right now for startups. Would you know any info on that, Joey?
I think that's part of the stimulus package that's being drawn up by the Congress and the executive branch that's in discussion. But my point to many of our MSMEs, the challenge really here is operating cash flow positive. So if you're not at that level, shut down your business because that will affect you. You'll incur more debt, or it will even affect your savings. So in our mentoring sessions, that's happening 3 times a day, 5 times a week. That is our advice to all micro, small enterprises. This is a health issue, which has led to an economic problem, and you're all affected. And if you're not in the essential sector, then just manage your cash flow. If you can't do it, shut down for the time being until the situation improves. Because I mean, it's pointless of just burning your cash. I don't think the government should lend money to businesses that are not viable, because that money will not be repaid. No? So the businesses that are really challenged, the banks are already extending them loans, and including and also the interest rates have been part of that. I mean, the interest payables have been lumped into those loans. No? So it would be challenging for us to subsidize even non-essential business models out there at this point in time, wherein the new normal is preventing many businesses from being viable for the time being. They will just have to shut down first rather than deplete their cash.
Yeah, that's a good one, Joey. I'd like to ask Josephine Yap also. She's our only industry panelist this morning. Josephine, would you like to chime in?
Well, yes, I think I agree with Joey that it's very much at this point in time a working capital issue for most of the companies.
Okay, may tanong rin dito. Renato Padilla is asking, are there any job opportunities out there? I think the programs for MSMEs will be stimulus at some point, but well, this is a very big question. Job opportunities, Joey, and Josephine also.
Migration to online, if you're a tech-savvy person, I mean, there are a lot of entrepreneurs, new entrepreneurs actually, that were born about because of this pandemic. Now you can see them all in the Viber communities, the Facebook platforms, on marketplaces. There are tons of them, housewives, turning into entrepreneurs overnight, doing pretty well. No, so that's a challenge, in fact, to many of the restaurants. So in the digital area, of course, this is the biggest opportunity, because the migration from offline to online is going to happen so quick at this point in time, but you have to have that skill. So, and of course, agriculture, that is definitely an area that has tremendous potential. It's essential, and we're looking and enhancing, and that's why we have another webinar on, I think that's the end of July, on agriculture, getting our people who've lost their jobs to maybe go back to the province for a while, plant something, be self-sufficient, things like this. No?
Okay, go ahead, ma'am.
Yeah. I was actually quite surprised because we found that we were able to hire a lot of sellers during this situation. So many people who had lost their job has applied with us. And the sales have been doing quite well because we recruit the sellers online, we train them online, we provide them all online marketing tools, and they even book their sales online. So it was really an eye-opener, you know, because I think also many people who maybe have been living with family, etc., decided that they don't want to be all together in one household and started to look for different their own household, you know. And then people were also shifting from condominiums to housing because of their, you know, their fear about being in a highly dense place.
Yeah. Okay. All right. I also like to welcome right now we have e-commerce. We have Attorney Chico Castro of Lazada PH. Can you hear me, Attorney Chico? Okay, Attorney Chico, I'm calling your name in case. We also have on transport logistics, George Royeca of Angkas. Can you hear me, George? All right. Okay. All right.
Karen,
Go.
Karen.
Yes, ma'am.
I'm
Yeah.
willing to forego my synopsis so you can have more questions, and I'll just answer. Yeah, but I think a lot of people are asking so many questions.
You can see it in our chat thread, no?
Yes, parang
So,
sayang questions no? We can help.
no, you can also do a closing, ma'am. I think lang, George Barcelon.
on
George, can you hear me? Why don't you go straight and ask your concern, George? The sad part is only that Joey Salceda is no longer with us. But please go ahead, George.
Okay. No, I just noticed earlier when Dr. Concepcion was presenting the public transportation, there was this age group of only 20 to 50 years old. I was just wondering, why is that a restriction on age? It's understood already before that as long as somebody is capable of walking unaided, they should be allowed to take transport because it's their livelihood. The other question I'd like to ask is lately, you have Makati Medical Center and St. Luke Hospital, both in Quezon City and BGC, announcing that their hospital is full capacity. In other words, they have more patients. Is that something to be concerned about? For these two premier hospitals announcing this full capacity.
Yeah, go ahead. Yeah, I can answer the St. Luke's and Makati Medical and.
Yes, go ahead.
If you wish.
Una, before that, Dr. Gisela, quickly muna, can you answer the transport issue? Why the 20 to 15?
So the mass transport is relating to back to work. So it's really the age group of the essential on-the-ground workers that we would like to limit to 20 to 50 years old because they would be in the best of health and have an ability to fight COVID. That's based on some companies in the US actually. So, but then of course it's your decision.
Because I take it that it's not the position of IATF, no?
No.
It's just a recommendation. Thank you.
Okay.
Okay, all right. God bless you for that, George. Dr. Padilla and Dr. Garin can answer quickly.
Yes.
On why is St. Luke's and Medical, what's that?
Makati Med.
Makati Med, yeah.
It's not just St. Luke's and Makati Med. It's also NKTI. It's also Chinese General. Basically, we have an allocation of ICU beds. It's the ICU beds that are really getting filled up now in St. Luke's. No, we still have beds for the COVID that are not ICU. Okay, then we still have beds for the non-COVID patients. But for the allocations, we had to open up another ICU already. That means that we really have a surge. I think Department of Health and IATF has also accepted we have a surge. It was expected. Why? Because we opened up our economy. No, that's one. Two is we have a mutation of the virus as well. No, they say it's more contagious but not more virulent. So my point is we expected. And again, pakiusap, no, it's not so much the age, it's more the age. When you get older, you're more likely to have comorbidities like diabetes and hypertension. There is a reason why we're protecting the vulnerable. And many of those who end up in the ICUs are these vulnerable people. Not just because of the age, it's the age plus the comorbidities that really make them vulnerable. So we're getting filled up, but not the entire hospital. So it's not really a cause for concern per se. No, but we have to protect also our capacity to treat non-COVID patients, because they make up even more of the people we have to take care of, non-COVID.
Okay, very quickly, I want to ask Dr. Garin kasi dapat sinagot to ni Joey Salceda kanina. Why aren't children back in school? Considering that children don't really have comorbidities. In fact, when you look at the data, children survive COVID. Even Am I right, Congresswoman Garin? The younger you are, and yet the IATF rules are you cannot go out GCQ if you are below, is it 18 or 16? There's an age. But, and all kids are online considering they're not the main, they're not affected the most by COVID.
Because they're the source of infection, Karen.
Okay.
Look at the situation that they don't have comorbidities. In the studies conducted, in the prevalence studies conducted, many of those are asymptomatic carriers, and they can actually be super spreaders, or those young generation. So limiting their movement will actually mean limiting a huge chunk of the population. On the issue of the hospitals filling up, I believe we have to have our friends in the media sector as partners in this, because it's sending a bad message. It's correct, we have to be transparent. The ICUs are filling up. So this means the moderate and severe cases are increasing because people are coming in late. Testing, people are now starting to be complacent. So the messaging should be up on the hospitals being filled up. Two things, it's not really the whole hospital.
Yeah.
ICUs. And a hospital cannot be a purely dedicated COVID center because it has to survive. They have to be economically viable. So two things, with this filling up, a message should be conveyed to the public that once with symptoms, early consult and early isolation is needed. Second, COVID is still out there and many are still getting infected. So we have to, because it can also send in panic to some. People will say, okay, let's close down everything because there's a lot of COVID out there. Again, we will have more non-COVID illnesses. So messaging is very key in this situation.
Okay, is the ICU surge dangerous? To all the doctors in the panel, George C. is asking. That means treatment may not be available when people need it going forward. Okay, can any doctor, the ICU surge is dangerous in Manila?
It's dangerous, Karen, because if you see an ICU surge, it simply means you have increasing number of cases. Remember, it's around 10% of the total infected patients. Balikan po natin the documented statistics where we are now at this point of time. In all the infected patients, 40 to 50% are asymptomatic. Out of the 50 to 60% that are symptomatic, 80% are very mild. Sometimes they don't feel it. 20% will be moderate to severe. Kung dumarami yung nasa ICU, you have to look at the denominator. It means it's expanding. That's expected. But we have to have less mortalities. Now,
okay.
Walang gamot, let me just put this, clear this issue, because many people, when they heard prednisone, kaliwat kanan yung iba nagsi-self-medicate. And this is especially in the provinces, many people are taking prednisone because it's cheap. But in COVID, there are stages. The first stage, your immune system is very important. Sa unang pagpasok ng COVID sa katawan, napaka-importante ng immunity. Prednisone actually suppresses your immune response. So in the second stage, yung epekto sa tao, it's not already because of the virus, it's because of your reaction, your body's reaction to the virus. That is where steroids come into play. So no to self-medication. Once you have mild or even asymptomatic COVID, lie down, rest, forget about problems, put down your phone, eat, and then take a walk or a jog inside your room, rest again. That is the greatest weapon that you have against the virus if you're asymptomatic or if you have mild COVID.
Okay. Dr. Law, would you like to add before we close? It's 12 o'clock and Dr. Padilla will be speaking.
I would like to address the issue of allowing only 20 to 50-year-olds to work. We have to be careful with these people as well, because some of them may have unrecognized conditions that will predispose to being severely ill with COVID. As far as children is concerned, not only are they a danger to their parents and grandparents when they contract COVID, some of them also develop severe disease like Kawasaki-like syndrome, and some deaths have been reported in children. Now, as far as ICUs are concerned, yes, we are filling up because we are getting better in treating them. But unfortunately, at this point, I appeal to those persons who are recovered to donate their convalescent plasma to these patients in the ICU to make them. This is your contribution, and probably as a way of saying thanks to God that you have been spared from the virus. So please, we have run out of convalescent plasma for our patients. And I have a classmate who is confined at the lung center as well, and he will be getting convalescent plasma. Hopefully he gets it. Thank you very much.
Okay. Thank you for that, Dr. Lo. I mean, it's so important that you said that, but it also worries me that when one person's recovered, they should be doing it as their civic duty and moral duty to actually contribute that. But thank you. Okay, guys, please be patient. Now the media wants to ask questions. So this is my request. I'm gonna call their names, ask the question, and then anybody among the panelists, including Joey and Dr. Padilla, can respond, and also DOST Secretary De La Peña. From the Philippine Star, Luella Desiderio, Philippine Star. Okay, Philippine Star.
Hi, can you hear
Oh,
me?
go ahead, ma'am. Go ahead, Luella. Please
A
go
while ago,
direct to the question.
Mention of Representative Garin that the guidelines for pooled PCR tests will be released by the end of the month. By that time, will we already see the price of the test per individual drop to the 350 to 375 level? And how soon can the pooled PCR test be deployed for workers in the private sector? Thank you.
Okay, great question. Direct to the point, Dr. Garin.
Yes, when we release the results, the pricing will also be incorporated. However, let me make this clear, it's a private initiative. We will be implementing it for the return to work program and in the specific populations and LGUs that I have mentioned in coordination with selected foundations. We cannot speak in behalf of the Department of Health, but I'm very sure they will be supportive and they will fast track the approval and cascading among government hospitals.
Okay. Now we have Bernie Magkilat of Manila Bulletin. Bernie?
Hi. Hello.
Yes, Bernie.
Kay Secretary Joey Concepcion,
Yes,
can we
go
ask
ahead.
if categorically if he is against any going back to the MECQ level?
Yeah.
Well, at this point in time, we have to try to prevent moving back unless the levels of infection really go sky high. But with the granularized approach, whereby we quarantine where the infection is, and that is now the pathway that the IATF has taken, I think that will be able to contain the virus. What is important is we have to create that visibility, you know, and that's why we are fast tracking pooled PCR testing to enhance the visibility. So we will know where the infection is, and then that's what we quarantine. I hope we should not go back to locking down the entire Luzon or locking down GMA. That was the past, no? So currently, I think we still are in control. Yes, the infection is going up, and that's expected as you open the economy. So that's why we have to enhance testing to enhance visibility.
Okay, thanks for that, Joey. And I think, Bernie, you might like this quote from Joey Salceda. You can message him. I am sure they record this session. He actually said, OA na ang lockdown. OA ang lockdown in the Philippines. That was an exact quote. I wrote it down. Okay, Denise Saludo of Manila Times.
Hi, I would like to address my questions. My question for the doctors. Well, first of all, I would like to thank everyone for sharing your insights. And I'd had an opportunity to connect and to contact with some medical doctors abroad. One of their issues is that they're focusing in the mass usage of non-medical regulated masks. But here in the Philippines, we have seen that a lot of people are using, fashionable masks, animated masks. And if that's the case, can a fashionable mask or those type of masks can give protection and help stop the spread of the virus? knowing that this could be an airborne or any type of disease that could spread. And
Okay.
another thing is that how can
go
we
ahead.
educate the mass about the issue? Thank you.
All right. Maybe Doctora Padilla, Mingita, and Gisela Concepcion, you can take this so we can spread the questions to the panelists.
I can give Gisela the floor first, and I can just
Okay, Gisela, go ahead,
She's
ma'am.
my aunt, actually. So
Okay.
aunt
All
first.
right.
Hello. So I am concerned about the kinds of masks that I have seen people wear, and I went out and traveled in a car for the first time over the weekend, and I saw many are wearing the masks. But you're right, they're fashionable masks, and it really depends on the fabric that is used for the mask and the pore size of the weave, right? So I think that the DOH should provide more guidelines on the acceptable masks that would prevent the virus from entering the person's inner portion or releasing the virus. That's very important at this point.
Well, Karen, yeah, are you
Yes,
done?
go ahead.
Actually, okay, masks, no? There's also OA mask wearers, okay? People walking around in the streets, in your house, you don't have to use an N95 mask. A simple surgical mask will do. It will already prevent 85% of spread of the disease. And the fashionable masks, it also depends. Some are too thick that you cannot breathe. So yes, there should be siguro guidelines as to what kinds of masks are minimum, but what kinds of masks will actually make you more unhealthy. Because I've seen masks that are so thick that I myself could not breathe through them. Okay? So we need to have some guidelines as to masks. But then again, let's not deprive our healthcare workers of the N95 masks. For me, a simple surgical mask, is the sufficient mask. That is the standard of any mask that you will wear, whether it's cloth or not. The simple surgical mask for the general population should be the standard. Okay, and leave the N95s to the healthcare workers in the hospital, who actually are looking at patients. Even us in the hospital, we're not even told to wear N95 unless we're really attending to patients. In the regular clinicals, walking around the clinic, surgical mask is enough. Okay, and that's a fair standard, even for the
All
cloth.
right.
Okay.
Okay. To our journalists here, may I suggest also, if you have additional questions or you want it expounded, you can message our panelists privately on the chat. I think they'll see it because I'm seeing messages come in. Please feel free to do that and they can respond to you. But I'll call now Roy Cavinel from Inquirer.
It's Carnival po. I have
I'm sorry, forgive me. Okay.
Okay lang. I have two questions for Project ARC po. First question is, out of all the asymptomatics that was tested by Project ARC, how many of them tested positive to confirmatory tests? And second question, Mr. Concepcion said that we should not go back to a lockdown unless the infection rate is sky high. So what would qualify as a sky high infection rate? Thank you.
Who are you asking? Who do you want to? Do you want
anyone from Project ARC?
Okay, I can talk about. Well, we have a lot of data that's still coming in, Roy. No, in fact, as you saw, although almost 1 million rapid antibody tests have been done, only about 100,000+ results are in. No? Now we have some, so I cannot answer you exactly how many have had confirmed. No? Okay, maybe now that I'm here, I can do part of my synopsis in the sense that you have to understand how Project ARC started and where we are now. When we started in April 2020, we had virtually no RT-PCR testing. 2,000, that's what we had, 2,000 a day. Many people would take their tests and they would die before they got the results. That's why the rapid antibody testing was the practical thing to do. And we just made sure that they were as reliable as possible. Not that all of them are made the same. We are finding some correlations, but you also should know that when you test positive for IgM, it doesn't mean you're going to test positive for PR. And it doesn't mean that there's somebody talking.
That's what Senator Ralph Recto
Wait, Karen, there's somebody talking in the background. Okay, anyway, so my point is we still don't have all the data, but we will report it as soon as possible because as Giselle said, this is very important data. And we did find a lot of infectious IgMs in the community who are asymptomatic. Two is when do you stay sky high? I think we have to put everything in context. No? Those of us, we doctors, who continue to work in the hospital despite the virus, even throughout the ECQ, we were going to the hospital. No? We don't fear the virus as much as we respect the virus. You have to always be mindful that it's there. So you go about your lives, you can go about our lives now with the virus, knowing it's there, with respect, an adversary. So you learn things. Simple lang yan, no? I think the time when it's over too much is when our hospital system is really overrun, where we can no longer attend to the other people who are non-COVID, where we say, hindi na namin kaya. Hindi pa naman tayo doon. Malayo pa ho. No? It's not yet that way. No? In the meantime, we must build more quarantine centers, as Secretary Garin said earlier. And so we are far from there. But the consequences of a lockdown can be even more serious than the consequences of COVID. Because what we saw was many people were dying from non-COVID diseases. Many people who needed dialysis could not get it. Many cancer patients from missing their chemotherapy. Many blind people visually disabled went blind because they couldn't be treated. Then you had alcoholism, domestic violence, theft. It was all on the rise. So there's so many ills, medical and social, that may be worse than COVID. Okay? So the only way to do this is we go about our lives, we respect the virus, we always are mindful of the virus, and we follow the 3 steps. Wash your hands with soap and water, keep your distance, wear your masks. Okay? And keep praying and know that everything will be over in God's time. But to lock down right now is not necessary. It will do more harm than good. That's it. Did you hear me, Karen? No. Okay. I couldn't hear you. I couldn't hear you.
Wait.
Joey? Yeah.
You're on mute.
No, I'm okay.
No, me.
Karen.
All right, Roy of the Inquirer, were you
Karen,
satisfied?
can I just add to that? Yeah,
Yes,
Karen,
please.
So your question is, that's why the private sector, and my appeal to the private sector is that we have to keep testing.
Yeah.
And that, as Mikita was saying, this is very important. The moment, even more so now that we are trying to open up, once the public transport opens up, you can expect that infection will also rise. So that's part of it. So we have to really, as private sector, contribute. And I think one of the most important things in the stimulus bill is the budget for testing. I think the budget being proposed by Jeanette, Congress, was something like 18 billion, right, for testing?
Is Jeanette still here?
Yes,
Yeah.
yes. The budget for Bayanihan 2 was 18 billion. But I believe we've already spent a lot on testing and equipments. It's the planning process, the logistical side, and making and maximizing what the government has. That should be addressed.
Okay.
About testing, Karen, no? Just one more
Yes.
thing. The pooled antibody testing. It's really what you should turn to when you're dealing with a pandemic or epidemic where you have a lack of testing equipment and manpower. It has been done in the past, even for the HIV epidemic. It was done in Wuhan. But it should be, as Dr. Law says, combined with antibody testing. That's the way you will be able to catch the real picture, because not all PCR testing will catch the virus, and not all antibody testing. They have to be done at a certain point and used together. That has been our message from the start. It is our message now. We have now new methods of antibody testing. We have the ELIXIS. We have the ELISA, just gotten FDA approval. If we can do these, if our laboratories can do both, the PCR pooled and the antibody testing using the ECLIA and the ELISA, we will really get almost a 98% picture of the virus. No? Now, for those places in the provinces, the rural areas, which do not have access to these laboratories we have, they can still try to do the pool testing. And if they cannot do the ELISA or the ECLIA, they can still resort to the reliable rapid antibody tests. But to do both will give us a better picture, will help us to catch the virus more, help us to catch it early, prevent the serious cases, prevent the deaths. That's it. That's really testing, but knowing how to use both in a complementary manner.
Karen, can I add
Can
on to
we? Yeah, but okay, we need to add because we have more members of the press that have questions.
Okay. Earlier a question was asked when Joey said we can only have a lockdown when there's sky high infection. Let's just be clear. Scientifically, it has been documented that the RO factor or the degree, the extent by which a person can infect other persons is acceptable at 2 or below. Ibig sabihin yung bawat pasyente makakapanghawa ka isa o dalawa. That should be the max. Now, if our RO factor will increase to around 4 or even 6, that's already a danger sign. We have no recourse but to go on lockdown. However, we should not waste a lockdown. A lockdown is not meant to stop or intercept the virus. The lockdown is an opportunity for us to test everybody, immediately isolate and separate the positives from the negatives. So that should be made clear. So if people will not help, if people will not practice social distancing, and we end up with an RO factor of 4 to 6, then it will be very fast. That 4 to 6 can increase to 7 to 8 measles has a transmission factor of 16 to 17. So you can see one infection can actually cause an outbreak in a few days. And if we have a lot of COVID cases, then our hospitals will be bombarded, non-COVID illnesses will set in, businesses will be closed, no investors will come in, we cannot recover. So moving forward, we have to test, isolate, but allow the economy to gradually return.
Okay, all right. Let's go now to Dem De Jesus of PSN. Dem, are you still there? Dem? Okay, maybe Dem, are you still there of PSN? Okay, I'll go straight to Irma Isip of Malaya Business Insight. Okay. All right. What about Ana Lea Gonzalez of the Manila Times? Are you still there? All right. So I tried to call.
Hello.
Go ahead. Yes.
Hi, yes. Good afternoon. There were discussions earlier about public transportation. How do we ensure the safety of those using the public transport? Especially may mga reports po ng infected cases sa MRT. Thank you.
Okay, Karen, can I answer that?
Who can answer that?
Yeah. Okay.
Karen?
Okay. Karen? Okay. Okay, on the trans. Yes, so. We can't hear you, Karen. Can I?
There's an echo, Jeanette. There's an echo.
Yeah, can you hear me now?
Yeah, Janet, we can hear you well. Go ahead.
There's a very good question on transpo and how can we assure the public that they will not be infected. Air-conditioned jeepneys and buses are actually more contagious than open air. So I don't know how to put it forward. But there has been a lot of proposals that you can have all these barriers and everything. But remember, they are not really thoroughly disinfected. So if all passengers are wearing masks and that talking and discussing inside the public transport is not allowed, then it will save a lot of people from getting infected. It will help us a lot if buses will be in open air. I know it's not that comfortable, especially if it's humid. But being in jeepneys, in tricycles, in motorcycles with open air will actually eliminate a lot of infection.
So may I add that there is a group led by medical doctors from UP that came up with recommendations to ensure minimum health standards in our public transportation system. And the lead person here is Dr. Tony Dance. And it's supported by many groups already, including Commute and PH commuters. And I can share this document with everyone. Okay, so it's got recommended guidelines for PUV owners and operators, physical distancing, minimum 1 meter, the usual. But I think that this has to get to the general public as soon as possible. Yes.
All right. Okay. Well, first, I want to thank all of you for today's for participating in today's forum. I have to say it's been very interesting and very informative. And for those who have a question, for those who have a question, I think you can message our speakers and panelists privately already. Dr. Padilla, just to make sure you don't have anything to close with anymore.
I don't think we have time anymore. I gave it
yes
questions lang. More important.
All right. Okay, thank you all of you. And before we end the session, we will be having a solidarity photo. Please turn on your camera's video and do a thumbs up upon cue. All right, game. So I think, is it Janina who's in charge? Okay, Janina, just say 1, 2, 3.
Hello? Hello?
Yes.
Hello. Ate Den, are you there also? Okay.
Yes. Okay, ready. 1, 2, 3, smile. One more. 1, 2, 3, smile. One more. 1, 2, 3, smile. Last 2. 1, 2, 3, smile. Last. Okay, last one. 1, 2, 3, smile. Thank you.
All right. God bless you all. And once again, congratulations to Project ARC and to Secretary Joey Concepcion. This has been informative and very helpful. Thank you to all our panelists. And the first thing I'll be doing is getting my anti-pneumonia vaccine and anti-flu vaccine. Thank you for that. All right. God bless you all. Thank you. Thank you.
Thank you. Thank you all. Thank you. Thank you.
Bye.
Thank you.
Bye. Take care.
Hmm.